No secret that the American healthcare system is in crisis. Chronic illnesses are at an all-time high, healthcare costs are skyrocketing, and patients are frustrated with a system that treats symptoms rather than root causes. More than ever, we need a radical shift in how we approach health. According to the CDC, 6 in 10 Americans live with at least one chronic disease, and 4 in 10 have 2 or more. These conditions account for 90% of the nation's $4.1 trillion annual healthcare costs. We are spending more than ever, yet people are sicker than before. The system is built to handle acute emergencies, heart attacks, infections, surgeries, but fails to address chronic diseases that impact millions. This gap between treatment and prevention is growing, leaving millions trapped in a cycle of symptom management. Medications lower blood pressure, insulin controls diabetes, antidepressants stabilize mood, but none of these heal. They only manage. Root causes like diet, stress, inflammation, and environment remain unaddressed. Heart disease kills nearly 700,000 people each year. Almost half of adults have cardiovascular disease. Over 34 million have diabetes, and 88 million more are pre-diabetic. Type 2 diabetes, largely preventable, makes up 95% of cases. Cancer is the second leading cause of death, often linked to lifestyle factors. Obesity affects 42% of adults and contributes to heart disease, stroke, diabetes, and cancer. Mental illness is also on the rise, with more than 50 million Americans suffering from conditions like depression, anxiety, and PTSD, which are deeply connected to physical health. Yet the medical system treats these conditions in isolation. The problem? The system is designed for symptom management, not root cause resolution. A patient with high blood pressure is given medication but no guidance on diet, stress, or sleep. Someone with diabetes receives insulin but no education on reversing the disease. This creates a never-ending cycle of prescriptions, increasing dosages, and more interventions. The system is also deeply fragmented. A patient may see a cardiologist for their heart, an endocrinologist for diabetes, and a psychiatrist for depression, yet none of these specialists communicate. The patient is treated as a collection of symptoms rather than a whole person. No one is connecting the dots or addressing how a single lifestyle change could improve multiple conditions. Margaret's story illustrates this failure. At 52, she suffered from high cholesterol, joint pain, and mood swings. Her doctors prescribed multiple medications, but she only felt worse. She was constantly exhausted, struggling emotionally, and unable to exercise. Frustrated, she sought a different approach. Instead of masking symptoms, we examined her diet, stress levels, sleep, and overall well-being. The root cause became clear: chronic inflammation, unmanaged stress, and poor nutrition. We introduced anti-inflammatory foods, stress management techniques, and improved sleep habits. Within months, her joint pain subsided, her energy returned, and she felt emotionally balanced for the first time in years. By addressing the root cause, not just symptoms, Margaret found true healing. Her story is not unique. Millions are cycling through the same failing system, dependent on medications without real solutions. The truth is, the system isn't designed to make people well. It's designed to keep them in treatment. The health crisis is not just medical, it's societal. It affects families, communities, and the economy. The cost of chronic illness is unsustainable, and without change, it will only worsen. But there is hope. People are realizing that true health is about more than symptom management. It's about treating the whole person, body, mind, and spirit. It's about prevention, lifestyle medicine, and long-term wellness. That's where hexagonal healing comes in. This isn't just a new way of thinking. It's a movement to take back control of our health, demand better care, and embrace a model of healing that integrates modern science with time-tested principles of wellness. The time for change is now. We can continue down the same broken path or embrace a new paradigm of health. If you're ready to break free from the cycle of symptom management and take control of your health, stay with us. In the next video, we'll explore how hexagonal healing can help you reclaim your vitality and transform your life.